I would like to introduce Traci Turner. Traci was diagnosed with acromegaly in the spring of 2017, and Traci is a registered nurse in Victoria, BC. Traci started out her nursing career in 2013 in neuroscience. Currently, her specialty is in perinatal care, both as an RN and a nursing instructor, working with childbearing families on antepartum, labor and delivery, and postpartum. When not focused on all things baby, Traci enjoys the theater, reading outdoors, and spending time with friends and family, and hanging out with me. Please welcome Traci.
That's a heavy presentation to follow. And my brain is spinning. So Deanna asked me to talk about my journey. I don't really like public speaking, so bear with me. As Deanna said, I was diagnosed early in 2017. So there's a picture of me and my youngest before I started to have noticeable symptoms. 2009, I started to have quite a few symptoms that were chalked up to perimenopause. I was only 36 years old, and I said, well, I'm kind of young for that, I would think, but a lot of the symptoms were very, very consistent with menopause. But then when I kept insisting that maybe it was more than that, my doctor kept saying, well, look at the stress in your life. So I kind of put some of the stressful things that were going on at the time. So my first husband had a very debilitating cerebellar stroke and needed a lot of rehab. I suddenly went from being a stay-at-home mom to the breadwinner. And my 16-year-old daughter had a baby. So I started nursing school because I was trying to support my family on minimum wage, and it wasn't working. My husband didn't cope well with his new life and new reality, and so my marriage broke down. I decided I'm going to be a nurse. I should probably quit smoking. You know, I'm an overachiever. So I kind of bought into it. Okay, you know, there's a lot going on. It's just stress. You know, maybe the doctor's right. Grandson. Started to have some facial feature changes, but of course subtle. I didn't really recognize them because I also quit smoking and started school. I packed on some pounds, so thought it was all weight gain. And then in 2011, I was able to actually lose all of my weight, so thought that was good. But then the symptoms kept increasing, and they were becoming debilitating to the point where I thought I might have to take a break from going to school because I wasn't able to function very well. My daughter had another baby. I was parenting teenagers and babies. I was a full-time student, and then my mom had breast cancer and ended up in palliative care. So again, the doctor just said, oh, it's just stress, it's just stress. Maybe you need to eliminate some of that. And of course, the only thing I could eliminate was school, but then I thought, then I'm going to have more stress, so I just kept going. I started working with a geneticist at that time, being counseled for the BRCA gene, because my aunt had just died of ovarian cancer, my mom had just died of breast cancer. So we were kind of thinking maybe this was part of our problem. So I had some treatment, trying partly to deal with the symptoms. I know a lot of women with acromegaly end up not menstruating. I went the other way and was hypermenstruating, which I'm learning now is it's kind of one camp or the other. But the symptoms just there was no relief. We kept treating things and no relief. And then new things started happening, so I needed to buy bigger shoes. I was noticing my gloves at work were feeling tight. I was starting to get arthritic type pain, and even though I had had some treatment for the menstruation problems, I was still battling severe anemia. kind of got lost in life, just, buying in that it's stress and life related, and just establishing my career, focusing on family and kids. And then I met a new fellow and started a new relationship. And so he started to point things out, that I had kind of been ignoring or shoving under the table. I ended up critically ill in 2015, was taken off of work actually for about 5 months, being investigated for why am I bleeding so much, why am I so tired. Resolved the anemia with some interventions. The doctors all thought, well, you should be feeling better, you're not anemic anymore. Well, it wasn't the anemia that was making me so sick. My lab work was all still normal, the lab work that they were doing, other than the anemia. But then my partner had said, you snore really loud. And I started gaining weight again, unexpectedly, with no change in lifestyle. And then my thyroid function started to come back unusual. So I had some investigations for that, and there were some nodules found. That kind of thing was being followed for that. And then I went for some blood work. I had to get some blood work redone because the lab lost it. So my doctor decided he would redo a whole bunch of lab work that I had done 3 months prior. And everything was abnormal. It went from completely normal to completely abnormal. And we both kind of went, oh, there's something more going on. So this was early in January of 2017. And I said, maybe I'm a little more complicated than you can handle. Maybe I need to see an endocrinologist. I think I have something autoimmune going on. And so we spent a couple of visits talking about things, and I got my referral, and of course, we all know it takes a long time to get in to see people in Canada. But I was still working on neurology as a registered nurse, and I had a patient with a pituitary tumor. And I came home and I said to my partner, I think I have a pituitary tumor. And he said, really? What they say about, where you work, you see everything, I'm like, okay, right, he's right. I'm seeing a tumor in me because I'm taking care of this person. So I ignored it. Kind of went about our day and planning our wedding and all just got busy. Finally had an appointment with Dr. Phillips. And I walked into his office and I sat in the chair, and he said, I don't even need to look at your chart. He said, I can tell by looking at your hands and feet you have acromegaly. He said, I'll do some lab work, I'll do an MRI, but you have acromegaly. And of course he was right. So that was in May. And then surprisingly, my MRI showed 2 tumors, and quite large tumors, one on the left, one on the right. And then there was this big debate for a few weeks about, was it one tumor that was really large wrapped around the gland, or was it 2 separate tumors? And there was not a consensus about what the thing was. So I was waiting for a consultation with Dr. Acromegaly. When in the middle of the night in July, I was woke out of a dead sleep by the most excruciating headache of my life, vomiting, couldn't walk, and was taken to the emergency room, and my tumor on the left had ruptured, and I'd had a small stroke in the tumor. I don't really remember a whole lot of that time. I ended up with acute adrenal insufficiency from the rupture, and there's a bit of a gap there. So I just have the kind of the story of my family telling me what that was all about. So I went and saw the neurosurgeon in August after I recovered, and he said we needed to take a wait-and-see approach because of the rupture, give my brain time, or my pituitary time to heal, my hormones to regulate, and see if it was indeed one large tumor that would just take care of itself, which apparently is something that happens. So we gave it the time, we gave it a year, and my growth hormone levels continued to rise. The tumor on the right continued to grow. So we realized that it was indeed 2 different tumors. So I guess, sorry, that was about 6 months. And then they tried medication. It didn't help at all. So then I had surgery in June of 2018. Oh, there's just some progression of pictures. It starts with the one with me holding the baby, and then kind of goes across the top and then across the bottom. So the picture in the black and white dress, that's my wedding picture to my husband now, and that was 3 weeks before my rupture. So when I look back at the pictures, I can really see the progression and change. So then I had my transfernodal surgery in June, and my numbers never stabilized after surgery. And they had thought that they got all of the tumor. But I also developed diabetes insipidus after surgery. It took a little bit to recover from that, but I did. I felt really good after, but my numbers never did stabilize. When I had my 6-month follow-up MRI, the tumor on the right was back and only 2 millimeters smaller than pre-op in only 6 months. When I had my MRI at a year after, the tumor on the left was back. So the decision that after many appointments and consultations and MRIs, the decision was made to try like all of the medications, the monthly injection, the daily injection, and Acromegaly. It didn't really do anything to my IGF-1 numbers, so, and the surgeon didn't want to reoperate. He said it was invading the cavernous sinus, wrapped around the carotid artery. So radiation was my best option. So that's what I did. In 2020, I ended up having radiation. And I had gallbladder surgery because the medications toasted my gallbladder. And then I had radiation. And so now I'm just kind of in this holding pattern of waiting and seeing. My numbers just keep hovering at the same rate. They go up and down about 20 points every check, but no real improvement. Symptoms are still persistent. And just kind of waiting and seeing and learning a lot from these conferences and trying to figure out a game plan. There is some talk about potentially seeing somebody. My endocrinologist has brought forward, maybe we should send you to somebody else for a second opinion. I am interested in looking at going to Stanford maybe because Dr. Miranda Fernandez has some specialty in the area of tumors like mine, but just in a holding pattern at the moment. And then just one thing I put in here, when my GP got my word of my diagnosis, he felt so guilty that I'd been going to him for year after year after year of all these symptoms, and he said, "What's one piece of advice you could give me?" And this is what I gave him, so. That's me. I gotta read it. So when a patient presents with symptoms that appear to have no identifiable cause, don't assume it's all in their head, and instead, ask yourself if it might indeed be all in their head. Sorry, I talked really fast.